A newborn baby is a joy for the mother, the family, and the society into which a child will eventually grow. But until recently, the prospects for this growth were critically at risk due to many factors challenging the lives of newborn children and their mothers. Just over a decade ago globally, the number of deaths of children under 5 years of age had reduced by half to just over 6 million before the onset of the Ebola pandemic. The global mortality rate of children under 5 fell again by 14% from 2015 to 2020, from 43 to 37 deaths per 1,000 live births. Similarly, the mortality rate of children in their first 28 days of life, the neonatal period, fell by 12% over that same period, from 19 to 17 deaths per 1,000 live births. Even with this progress, 5 million children across the globe died before reaching their 5th birthday in 2020 alone, down from 5.9 million in 2015. Almost half of those deaths, 2.4 million, occurred in the first month of life. Sub-Saharan Africa remains the region with the highest under 5 mortality rate in the world at 74 deaths per 1,000 live births in 2020. This is 14 times higher than the risk for children in Europe and Northern America. Sierra Leone has drastically reduced its own share of mortality and morbidity associated with childbirth, but is faced with the challenge of further reducing the country's maternal mortality ratio, which has dropped from 7 to 4 deaths per 1,000 live births. Nevertheless, every maternal death, regardless of the cause and place of death, is unacceptable to the family and to society at large. In Cambia district, where some of the highest mortality rates have been reported, the district medical officer is keen on finding solutions, such as solar power, that will provide more accurate data on the parameters indicating the safety of women from pregnancy to delivery.
They started their installation activities since last year, and I think they've done it for 9 of our health facilities, and this is what our nurses have reported to us. One of the impacts of the installation of this solar system is it has really enhanced their work, especially in the labor unit during the night, you know. Secondly, again, it has improved the security, because mind you, this installation is not only done for the health facility, but it's also installed in their quarters, you know. So, you know, these are women, and medical activities are done throughout the day and night. So, and sometimes they feel before this time they were afraid to come out and walk out of their quarters to move to the health facilities. But since the installation of the solar system now, they now feel secure to move from their quarters and come to the health facility to do their clinical work. Another area again they reported improvement is in the area of reporting. Now they charge their phones, they charge their gadgets, and then do their inputting, you know, on time, and then sending their report on time. So these are basically some of the impacts we've seen since the installation of this solar gadget in 9 of our health facilities in Cambia district. This is our wish to have this solar gadget being installed in all of our health facilities. Yeah, because what we apart from the chiefdom headquarters, where we have the national grid, but for health facilities that are outside the chiefdom headquarters, they don't enjoy light, you know, as the ones in the chiefdom headquarters. So what you see in these other health facilities is just, you know, light in the labor room, you know. Apart from that, so the corridors, the other The other units, they don't have electricity. Not to even mention their quarters. But with what Tenn is doing, they will lit up the entire health facility as well as the quarters. So we want it on the bigger scale.
For renewable energy solution providers like the Energy Nexus Network, solar power for maternal care health providers around the clock is an important way of reducing risk to mother and child through their Health Innovation Program.
The Health Innovation Program, our focus is on powering healthcare in last mile community, and we look at primary healthcare sector in Sierra Leone. Recently, we're working in Cambia District and Western Luland District, and since 2023 to now, we succeeded in deploying 18 solutions, 9 in Cambia, and then 9 in Western Luland District. And in this, we have done 2 CHC and 2 CHP and up to 15 MCHP in both districts. And these deployment of DRE, Decentralized Renewable Energy, specifically solar, have reached up to 130,000 people have benefited from this that come to the health facility for their health issue, especially delivery. And also we impacted up to 168 villages because we calculate based on the catchment villages available and catchment population. And then in our system, we focus on sustainability because we realize that smaller solar system, like we basically started with 1 kilowatt system, and then we went on to 2.5, and now 3 kilowatt system. We realize that this smaller system can last for long, focusing on sustainability plan. And our sustainability procedures start with engagement. We engage the Ministry of Health through the DHMT at district level, and then they have to choose the facility for us. And when we have this facility, we go on to engage the community people, and we make sure we engage them, and then we do our need assessment. And our need assessment data focus on electrification data, health statistics, and also infrastructure. So we don't just give electricity for a specific facility, we also look at other issues, like if this is a facility they are having leakage issues, so we consider, is it possible that we place our battery here and they are having leakage issue, how can we amend this leakage issue? So we try to engage with other organization, NGOs that can help us to solve that leakage problem. And we also look at the facility itself. How long will this facility be like wash? Let's say we focus on wash area. They might have electricity now. If we give them electricity, what about wash? There are other constraints, so we try to address them. But mainly we use energy, the light itself, as an entry point to all the facility, and then we started addressing other issues concerning that. Currently we also give in medical technology, basic medical technology tools for these nurses, and we choose 2 facilities for a pilot, a proof of concept, and we deploy in that medical, and we give them training on how to use it. And it's also used by solar, a rechargeable system that they can use for a longer period, minimum of 5 years. And also in our sustainability plan, we continue to engage the EPC, which is the energy procurement company. We make sure that we do our forward and backward linkages, where the technology is coming from, the end user of the technology, and then how we can trace back in terms of fault maintenance or troubleshooting.
Energy for medical equipment can alleviate many clinical constraints, but providing energy solutions is also an entry point for a wider scope of development in the community.
My name is Paul. I am Dr. Paul T. Yilea. I am the Manager and Chief of Operations at the Energy Nexus Network. The Energy Nexus Network is a regional knowledge and facilitation hub for scaling renewable energy solutions. We see ourselves on a mission to build resilient ecosystems around decentralized renewable energy. We know that development itself needs energy as a catalyst, and so we are taking energy as an entry point towards development. At the moment, we are linking energy with health, linking energy with the agricultural value chains, and then linking energy also with livelihood. So there could be income generation, improve income revenue streams for small businesses, and we are doing this in an integrated way. We deploy solutions, but with the aim to scale. But to do that, we try to do proof of concept. Once the proof of concept is verified and it is working, then we scale. So for example, we have powered 18 facilities now combined in Western Rural District and in Cambia District as a proof of concept. And these proof of concept also have add-ons. Out of those 18, we are adding on equipment for last mile communities that can facilitate reproductive health care. Simple gadgets that have parameters that measure the well-being of pregnant women and the baby they carry. Once we get that tested and it is working well as a proof of concept, we want to scale beyond those in those districts and then beyond those districts for the entire country.
The birth of a child can occur at any time, and access to maternal care around the clock is important, especially for night deliveries.
During our intervention in some of these communities, particularly on the health sector in Cambia, we discovered that most of these health staffs, they use church lights, they use their mobile phones, put them in their mouths to do deliverings. So we discovered also that 70 to 80% of the deliverings happen at night. So we use energy as an entry point and in improving some of these cases. Like you can see in Library now, we came here, there was no lights. So from the intervention now, we can understand from our nurses, based on what we interacted with them, that they can do their delivery now in normal, without problem, because there is electricity everywhere. And also patients don't have fear to come to the hospital, even at any time. We can also see that in terms of the delivering has also been increased. And some of them also share testimonies that sometimes they used to prepare their records, their reports during the day, because there is always a fear that there is no electricity at night. But because now they have electricity at the center, they can do their reports at any time, even at night. They can send their reports. So these are some of the testimonies, some of the success stories we want to see. And now, though we have given electricity to some of these facilities, in Library to be specific, in Tonko Limba, Cambia District, but we also want to scale up to other facilities. And not only to scale up, but we also want to see that if you want to ensure you have your optimized system, a healthcare facility, you also have to look at holistic approach, in the sense we also see they have a problem with water facility, which has to be addressed with other partners. So now we are trying to bring some partners like CAWEC, like Gold Sierra Leone, wherein they can come and address some of these issues.
Competent birth attendance is important for reducing maternal and newborn morbidity and mortality. Most births are assisted by skilled health professionals, including medical doctors, nurses, and midwives like maternal child health aide Marianne Munu, nurses in church Henrietta Kagbo, and Mabinti Toure, who can attest to the improvements in mother and child prenatal and antenatal care.
Inside Ula Tank MCHP, when they get more unit at that so. You reduce gradually, we will not get and so.
But now, I tell God thank you. Wait and the non-car with this light. They don't do well for we. Let God bless you now. Let God add more blessing for you now. Let God give you now well body and long life. Tell let God bless you now.
Apart from lack of energy, isolation is another factor contributing to the high incidence of health hazards and deaths among mothers and their under 5 children. Most roads leading to catchment areas outside of the main district capital are difficult to navigate and thus become last-mile communities in terms of access to life-saving interventions. Despite such challenges, the Energy Nexus Network hopes to address maternal and child health along with many more development issues by using energy as a convergence point for innovation and sustainability.